My name's Brett Burton with One Harmonic Motion, and we're going to talk about how the vasculature system responds when we apply blood flow restriction training bands onto either the arms or the legs. I'm going to use these straws as an example. When we look at the difference between an artery and a vein, the pink straw represents the artery. This is stiffer and harder to collapse. The green straw represents the vein. This one is easily collapsed and less rigid. If we're using a system that has the ability to occlude, what we need to do is determine what's called the limb occlusion pressure. The limb occlusion pressure is the point that we reach where both the vein and the artery are closed. Now, if I use an occlusive based system, what I would need to do is I would need to close off both the artery and the vein, determine my limb occlusion pressure. I close both these down, I'm going to eventually lose a pulse. And then I would need to back off a certain percentage to ensure that it's safe for me to train. There's some bands on the market that are not intended to occlude. We will apply pressure gradually to the limb and we'll reach a point where the vein is closed when the band is applied, but the artery is still open. And that artery open allows for blood to continue to keep moving through the system. This ensures that BFR training is done safely to where we've got blood flow moving in and out of the limb. Both types of systems can be safely used to apply blood flow restriction training. They just work in a different way, and as you can see, there's a different way they impact the vasculature when you're getting your band set up.